What ethical dilemmas arise in dementia decision-making? Imagine watching someone you love slowly lose their ability to make choices. Dementia can make decision-making tricky for everyone involved. As the disease progresses, people with dementia often struggle to understand their options or communicate their wishes. This creates a tough balancing act for caregivers and healthcare providers. They want to honor the person's past preferences and respect their independence, but they also need to keep them safe from harm. For example, allowing a person with dementia to walk freely might lead to falls or injuries. Restricting their movement might protect them but can also make them feel trapped or lose their dignity. Another big challenge is deciding what is truly in the person's best interests when they cannot speak for themselves. Family members or legal guardians must step in and make choices that reflected what the person would want. But this can be complicated because everyone might have different ideas about what is best. Sometimes, family members disagree about treatment options or care plans, leading to conflicts. Caregivers also face the question of how much information to share about the diagnosis. Should they tell the person everything, or might that cause unnecessary distress? Full honesty respects autonomy but can sometimes upset the individual or cause anxiety. Care decisions also involve balancing the needs of the person with dementia and the needs of caregivers. Caregivers might need breaks or support to avoid burnout, but their needs can conflict with what the person with dementia wants or needs. Privacy is another concern. As cognitive abilities decline, protecting the person's confidentiality becomes more complex. Caregivers must decide how much to share with family members or medical teams while respecting the individual's dignity. The use of restraints or medications to manage difficult behaviors raises ethical questions too. While these tools can prevent harm, they can also infringe on personal freedom and dignity. Caregivers must weigh the benefits and risks carefully. Resource allocation is another issue. As dementia cases grow, healthcare systems face tough choices about how to fairly distribute limited resources. Society also has a responsibility to combat discrimination and stigma against people with dementia, ensuring they are treated with respect and fairness. Finally, involving people with dementia in research is ethically sensitive. Researchers must protect them from exploitation while respecting their rights and dignity. All these dilemmas requiring thoughtful, personalized decisions based on principles like respecting autonomy, doing good, avoiding harm, and fairness. Open communication, collaboration among families and healthcare teams, and following established ethical guidelines can help navigate these complex situations. Remember, every person is unique, so decisions should always consider individual needs and values. Consulting healthcare professionals is essential to ensure choices are safe, respectful, and appropriate for each person's situation.